How are you?
Good, how are you?
I'm doing well. My name's Tyler. I'm a nurse down here. I'll be doing a physical exam on you today. I'd like to examine your skin, heart, lungs, and abdomen. If that's okay with you. Do you have any concerns or issues we need to discuss before I start?
No.
Okay. Very good. I'm going to go ahead and wash my hands before we get started. So we'll start out real basic. I'm just going to ask you a few questions. I'd like to verify your name and date of birth off your wristband. Can you tell me your full name?
Jade Murray,
Very good. What's your date of birth?
11/3/99.
Great. Do you know what today's date is?
Tuesday, October 3rd, 2017.
Perfect. Do you know where we're at today?
The hospital.
Awesome. And what are we doing here?
General examination.
Awesome. So at this point, the patient is awake and alert. She has spontaneous eye movement. She's sitting appropriate in the bed. Her responses are appropriate. She's oriented to person, place, time, and circumstance. At this point, I'd like to go ahead and proceed and start the physical examination. I'll start with your eyes, if you don't mind. All right, so we'll use a little light up here. If you can, just go ahead and focus up here at the ceiling, kind of at a distance for me on a fixed point. Okay. You can blink for as you need. So at this point, the pupils are round, and they are both equal bilaterally. Bilaterally, the pupils are reactive to light. Now, at this point, I'll have you focus on this pen for me if you can. Just maintain your focus as I'm moving closer to you. All right, at this point, both eyes do accommodate appropriately and are capable of accommodation. I'll have you follow this pen for me without moving your head, just with your eyes on it. Very good. Very good. Great. So all cardinal fields of vision are intact, going out nystagmus. Is there any extra oculomotor movements? At this point, I'd like to go ahead and take a look at your ears. So again, we'll use the light. I'll start on your right side here. Before we actually examine the inside, any tenderness to the outside of the ear here?
No.
Okay, very good. On the outer ear here, no redness or inflammation is noted, no drainage. Go ahead and insert. I'm going to lift up and back on this middle portion of your ear here. If at any point I'm hurting you, just let me know. Very good. So the tympanic membrane is easily visualized in this right ear. There wasn't an excessive amount of debris or earwax present. In appearance, the tympanic membrane was gray-white with a light reflex present at a 4 o'clock position. If you don't mind, if you could just kind of look over here at me, we'll do the same thing. I'm going to move your hair. Any tenderness here? Is that touch?
No.
Very good. And again, no noted inflammation or drainage, redness, anything to the ear here on this left side. I'm going to pull up and back here on this middle portion of your ear. Just let me know if at any point I'm hurting you. Very good. So again, no excessive debris or earwax was located in the ear canal. The tympanic membrane was easily visualized. In appearance, it was gray, white, with a present light reflex at about 7 o'clock on this left ear here. We'll go ahead from the ears now, and I'm going to assess your mouth and your oral cavity with a tongue blade and a light here as well. So initially look in the lips. They're symmetric, they're pink, the color's consistent throughout, and they're moist. If you don't mind, if you can go ahead and open up for me. Very good. Thank you. So we'll look at both sides of the cheeks here. The roof of the mouth. If you don't mind to lift your tongue up. Perfect, thank you. And if you could stick your tongue out. Great. You can bring it back in. I'm just going to So, assessing the oral cavity, the mucous membranes throughout the oral cavity are intact. They're pink and they're consistently moist throughout. No signs of inflammation or infection throughout the entire oral cavity. The teeth were well seated. The fine limits in the gums, no issues there whatsoever that I could note. From here, we'll just do a general assessment. I'm going to go ahead and start with your skin. If you don't mind, I'll take a look at this right arm first. So looking at this aspect of the right arm, the color is pink and consistent throughout. Color is consistent pink throughout. I don't note any lesions or masses here just on visualization. I'll go ahead this time with the dorsal side of my hand, physically touch the arm here. It is warm and dry to touch. I don't note any areas of excessive dryness or moisture at this point. No signs of pallor, cyanosis, or jaundice is present. We'll go ahead and flip you over if you don't mind, palm up. Again, throughout here, color is consistently pink. No lesions or masses are visualized. No signs of jaundice, pallor, or cyanosis. Feeling on the arm here, it is warm and dry to touch. I don't note any areas of excessive dryness or moisture. If you don't mind, we'll go ahead and do this same arm over here. Okay. So again, color is consistent and pink here. No lesions or masses noted. No signs of jaundice, pallor, or cyanosis. Feeling they are warm to touch and they are dry. I don't note any areas of excessive dryness or moisture. And on the posterior side here as well, color is consistent, pink throughout. No signs of jaundice, pallor, cyanosis, lesions, or masses that I can see. Down here on the posterior portion of the leg, I'll start down here in the lower part of the lower extremity. Color is consistent throughout. No lesions or masses, no deformities noted here. No signs of jaundice, pallor, cyanosis. Feeling it's warm to touch. It is dry. No excessive dryness or moisture noted. On the left side, again, the color is pink and consistent throughout. I'm going to lift you down up just a bit. Take a look at you. And then throughout the legs, the lower extremities here on the right and left side bilaterally, the color is consistent throughout. It's pink, no lesions or masses noted visually, no signs of jaundice, pallor, or cyanosis. Feeling on the left leg, they are warm to touch and dry, no excessive dryness or moisture present there. I'm going to go ahead and get you to bend your knee if you don't mind on both sides. Looking at the posterior portion here, color again is consistent, pink throughout, no lesions or masses noted, no deformities. I don't see any signs of jaundice, pallor, or cyanosis bilaterally. I'll go ahead and feel the upper and lower portions here. Sorry, my hands are cold. Warm and dry to touch. No excessive dryness or moisture is noted. And again on this side, warm, dry to touch. No excessive moisture or dryness is noted. You can go ahead and relax on this if you would like. And just part of a vascular exam now. I'll go ahead and take your blood pressure first. Is there either arm that I can't take your blood pressure in for some reason?
No.
Very good. So I get you to just relax your arm right here for me. Locate the brachial arteries here. And then appropriately place the blood pressure test. Cold stethoscope going to be on your arm, and then you'll feel quite a bit of pressure on this arm. If it's too uncomfortable to bear, just let me know. blood pressure in the right arm with the patient in the supine position, resting comfortably, was found to be 121/64. At this point, I'm just going to touch your wrist here. We're going to locate your radial pulses. Very good. So pulses are present bilaterally. They're equally as strong. I would rate those at a 3+. The heart rate was found to be 62 beats per minute. The rhythm appeared to be regular up there, so all is well with your pulses. I'll go ahead and kind of slide down here to your lower extremities. I'm going to check you for edema. Here, sorry, that moved a bit. For edema in the video 1, 2, 3, 4, 5, blood pressure. No edema present. This would be a 0 edema on the lower extremities in the tibial area. I'll go ahead and while we're down here, I'm going to locate your dorsal tibialis pulses. Pulses down here are easily palpable. They're present bilaterally in both feet. The rhythm is regular. Pulses are strong. I've rated those at +3. The rate appears to be about 60 per minute. You can maintain just laying down for me there as long as you're still comfortable. I'm going to begin with your heart now. Just a second. Okay. So initially, just looking at your chest here, I don't see any pulsations. Any pulsations or any deformity up here. The skin is pink, consistent throughout. I don't note any jugular vein distension as well in the neck. Go ahead and lean down here, look at the contour of the chest. As you breathe, I don't notice any heaves or lifts present in the chest. This position appropriately for visualization. So at this point, I'm just going to take a listen to you. So auscultating first with the diaphragm. We'll use 5 points of auscultation for this. You just stay relaxed. First, the second intercostal space, right sternal border. Second intercostal space, left sternal border. Third intercostal space, left sternal border. Keep you decent. Sorry, this is cold. In order to keep you decent here, I'm going to lift you down a ways. You do have short tongue.
Yeah.
Okay. So lift you up just a bit. That should be fine. Fourth intercostal space, left sternal border. Sorry. Okay. And the apical aspect here, the fifth intercostal space, left midclavicular line. I'm going to listen a bit longer this time around. Just bear with me. Very good. So I'll go ahead and listen to you today. I'll now repeat that. So again, at our first location, second intercostal space, right sternal border. Second intercostal space, left sternal border. Third intercostal space, left sternal border. Under again. Fourth intercostal space, left sternal border. And fifth intercostal space, left sternal border. Very good. So throughout the entire cardiac auscultation, I didn't note any murmurs, extra S3 or S4 sounds, any splitting. The rhythm did appear to be regular at the apical point. Did get a pulse of 60 there, which matched the radial pulse. So all was well with the cardiac auscultation. Now I would like to kind of assess your trunk, your thorax, and your lungs. If I could, I'll have you kind of sit up on the side of the bed, or you can just sit up where you're at, whatever's comfortable for you. Okay, very good. So we'll go ahead and start with the posterior here. The posterior portion of the back, the thorax, the skin is consistent with pink. I don't notice any deformities, any lesions, any masses on visualization. The thorax is symmetric. Just, can you take a big deep breath in for me? She maintains symmetry there. We'll go ahead and auscultate at this point while I'm at the back. Again, a cold stethoscope back here. If you're able, I will have you just take a deep breath anytime you feel my stethoscope move. Okay. Just as you can tolerate deep breaths. I'm sorry. One more time. Very good. just on this right side one. It's a little bit cold. I apologize. Very good. So their breath sounds were present in all lobes. I didn't hear any signs of diminished breath sounds. Predominantly bronchiovesicular sounds were heard throughout the lung regions. Also didn't note any adventitious sounds, such as crackles, wheezes, rails, or rhonchi. We'll go ahead and again, with the thorax, just start by visually inspecting. Looking here, I don't see any skeletal deformities, no tracheal deviation. The chest appears symmetric. The skin's pink and consistent throughout. No lesions or masses that can be visualized. If you will for me, just go ahead and take a big deep breath in. Okay. So the chest remains symmetric throughout inspiration. Go ahead one more time, big deep breath. Very good. Looks like she has a AP ratio of 2 to 1, which is appropriate. We'll go ahead and auscultate here. Same again. Take deep breaths as you can tolerate. Very good. I'm going to come up under you here just for one. We'll keep you decent. Big deep breath. Very good. Big deep breath. Very good. All right. So again, breath sounds on the anterior portion here were all present. Didn't hear any signs of diminished spaces or diminished breath sounds throughout all lung regions. Didn't hear any sounds of adventitious sounds such as wheezes, crackles, rails, or rhonchi, and predominantly the sounds heard were bronchiovesicular sounds. Up top became a little bit more vesicular in sounding. All right, if you would, for me now, we're just going to take a look at your abdomen. You can go ahead and lay that down for me. Are you comfortable here?
Yes.
Okay, very good. I understand you have a history of irritable bowel syndrome.
Yeah.
Any problems here recently at all?
No.
Very good. I'm going to raise you up here just a bit, just to get a little bit closer to me. Not leaning over quite as much. Go ahead and just have you relax your hands down by your side. Lift your gown up here a bit. We'll keep you covered. Okay, so just by visual inspection here, the abdomen is symmetric. I don't note any lesions or masses. I'm not noting any pulsations or visual peristalsis here. I'll go ahead and kind of get down by the side. The contour of the abdomen is flat. Appropriate. Very good. The skin is pink and consistent throughout. Umbilicus doesn't show any signs. I'm going to pull you down just a bit. Any signs of any infection or inflammation, redness, anything like that. So go ahead and just take a listen to you here first. Sorry, it's so cold. Very good. So bowel sounds are present in all four quadrants. They were all normal active. I would say about 8 to 10 a minute that I had heard. I'll go ahead and begin with just some light palpation here, not a whole lot of pressure. Any tenderness?
No.
Okay. Tenderness?
No.
Here?
No. No.
Very good. So with the light palpation, she didn't report any tenderness. I didn't visualize any guarding or physically tensing up, and also no facial grimace throughout the entire abdominal assessment. Now I'll do it just a bit deeper palpation, a little bit more pressure. Let me know if you have any tenderness or pain. Here.
No.
A lot of pressure on this rib here. Very good. Here.
No. No. No.
Okay. So deep palpation didn't produce any guarding in her, no verbalized tenderness. I didn't notice any facial grimace throughout. Deep palpation also didn't produce any masses that I can note. I don't visually see or feel any lesions on her abdomen. The only organs I could easily palpate on her were the liver. I did feel well-defined borders on the liver within appropriate normal limits of this right coastal region. So no signs of hepatocmegaly there. And then also over here with the spleen, did palpate the region of the spleen and everything was within normal limits there to find the border. So overall, no signs of organomegaly throughout the abdomen. Now I'm going to lower you back down. Sorry, it was a bit fast. Sorry. I'll have you go ahead for me if you can and just squeeze my fingers. So tight. Squeeze. Very good. So ribs are equal in strength bilaterally. I would rate it at a 5 both ways. No issues there whatsoever. I'm going to come down here to your feet. If you can, I'm going to get you to just flex your feet downward as if you were pushing on a gas pedal. Just 1 second, I'll have you repeat that. Okay. Just again, you're pushing down on the back. Okay, very good. So dorsiflexion is present in both feet of the lower extremity. The strength was equal bilaterally. And I would rate that as a 5 as well. No issues there with that muscular system. What I'll have you do now, if you don't mind, you can sit up on the side of the bed. I'll help you get your shoes on, just so we don't fall as we're standing up for this last part of the assessment. Do you have any questions or concerns thus far?
No.
Okay, at this point, I'll have you just stand up and face the wall. If you don't mind, I'm going to take a look at your back. So just visually inspecting the spine here, cervical, thoracic, and lumbar area. I don't see any deviations in the spine. It appears straight and in alignment. What I'll have you do now is I'm just going to feel. Let me know if you have any tenderness or pain as I any pain at all?
No.
Okay, very good. So no guarding or anything there throughout either. Doesn't complain of any tenderness along the spine or the paravertebral areas. What I'll have you do now is I'm just going to kind of untie your gown for this part so I can visualize your hips as well. And I'll hold it up top this way and I'll fall over. Just as much as you can tolerate leaning forward for me. Okay, very good. So inspecting here, the iliac crests are even, so no signs there of scoliosis. Looking at the spine, we're still in alignment. I don't see any skeletal deformities. Again, she don't complain of any pain throughout.
No.
easily visualized with her leaning over here. No deformities whatsoever noted. So, looking at her spine from an angle, I don't see any signs of lordosis or kyphosis as well. You can go ahead and stand back there. I'll lay you back there. So overall, do you feel that there's any issues that we left unaddressed or anything that